So this patient came to me with 2 skin cancers and a wedding on the horizon. You're going to want to hear this one. By the way, I'm Dr. Jordan, cosmetic dermatologist, and if you're new here, feel free to subscribe to the channel. So imagine you have one of the biggest days of your life coming up, and your doctor tells you you're going to have surgery in the middle of your face. Not once, but twice. That's exactly what happened here. This beautiful young woman had 2 skin cancers on her nose, the middle of her face, and we needed to treat them because it's her health. Okay, so if you're in this situation, there might be a time where you want to push it off and wait till after an event, but it's not always the best situation. We do want to take care of your health as a #1 rule. So when she came to us, we had to figure out what is the best way we can handle this. So these skin cancers are called basal cell carcinomas. There's different types of skin cancers, and you can learn about those on my other videos. But this was a basal cell carcinoma, and they're rarely metastasized, but it's one of those types of skin cancers that occur on light skin, and they can occur from sun exposure and UV damage. The gold standard for removing these basal cell carcinomas on the face is going to be something called Mohs surgery. That's called Mohs micrographic surgery. That's when we take the smallest amount of skin possible to remove the tumor. Basically, we take that skin, while you wait, we process it in the lab on site, and we make sure that all the margins and edges are clear so that when it's clear, we can close you right back up. In this case, our patient had 2 of them. So in this case, we did them on 2 separate days. That way, one suture is not pulling on the other one. So as you can see, and as you know, their nose is in the middle of the face. So yes, we want to be very strategic about this. So when we close, we use flaps, we use geometry to close the skin and hide the scars within the cosmetic subunits. That means we're trying to hide a line in discrete areas so that the naked eye can't really see them that well. After both of these surgeries were complete and we knew the cancer was totally gone, we approached the final result with lasers. We did 2 of them. We did my favorite laser, as you guys know by now, CO2 resurfacing laser. That's a fractionated ablative resurfacing laser combined with a vascular laser. She has a little bit of pink to her skin. So while reducing some of that redness, that pinkness, we also retextured it with that CO2. Honestly, I'm super proud to say that this turned out beautifully. She ended up showing me pictures of her wedding, and she looked absolutely stunning. And to be able to play at least a small role in that, it was really rewarding, and I'm really grateful for what I do. So if you have any suspicious moles or spots or growths on your body, please don't hesitate to get it checked out. If you have any questions, please leave them in the comments below. And if you're in the Chicago area, come check us out.